The State Commissioner for Health, Dr. Modi Onoye, said maternal and perinatal death surveillance and response was a critical approach to improving the quality of maternal and neonatal health care and a proven strategy for achieving the Sustainable Development Goal 3, which is to reduce global maternal mortality rate to less than 70 per 100,000 live births and to end preventable deaths of newborn and children under 5 years. Dr. Onoye said the state had made progress since the publication of the maiden edition of the report 2017-2018, which highlights the improvement in the quality of maternal and newborn care. He said institutionalization of the maternal and perinatal death surveillance response process in the state, local government, and health facilities across the state would ensure that no aspect of maternal and newborn health care was left unattended.
Yes, we've seen the report. And obviously you heard what was said. We've noted areas where we need to pay more attention. We want to keep praying and supporting the government of State Dr. Kolo, who incidentally brought for the contributory health scheme to enable issues like this be attended to, where mothers, pregnant women under 5, treated by government. They are being paid for by government. And Delta should exploit that particular opportunity and get themselves into the scheme.
Presenting the Maternal and Perinatal Death Surveillance and Response Report 2019 to 2020, the co-chairman of the State Steering Committee said high maternal mortality was an indication of the lapses in healthcare system. Hence, the Maternal and Perinatal Death Surveillance and Response process seeks to identify preventable maternal deaths through detailed community audit process in order to address the cause of death and prevent future occurrence. The permanent secretary in the State Ministry of Health, Dr. Ejiro Ogenega, and his counterpart in the Primary Healthcare Development Agency, Dr. Wilfu Orieke, said antenatal care was key to reducing maternal and perinatal deaths and urged Deltans to key into the various health programs of government, including the Community Health Influencers Program and services, where pregnant women are encouraged to register for antenatal in the nearest health center where they reside.
For young girls who, of course, they get pregnant one day, they get married and get pregnant one day, they should enlist in the programs of Primary Healthcare Development Agency. We have a program for young girls, which we call adolescent nutrition.
The event featured goodwill messages from different organizations and the formal launch of the report. The Delta State Steering Committee of the Maternal and Perinatal Death Surveillance Response was inaugurated in 2015 in line with the decision of the National Council on Health to adopt maternal and perinatal death auditing as a tool for improving maternal and perinatal health care and preventing deaths. The recommendations contained in the 2019-2020 report included that the MPDSR bill, which has gone through public hearing in the State House of Assembly, be passed by the House and forwarded to the State Governor for assent, and that a policy-defining role of traditional birth attendants in the provision of maternal care in the state be made. Eunice Emeyazia reporting.